Hello, thank you for joining us today. My name is Susan Evans, and I'm honored to welcome you to today's webinar featuring our team from the BCAT. These women will have a conversation about cognitive wellness. Yes, cognition is a vital sign. Please utilize the Q&A function to submit your questions during the webinar. Additionally, a copy of today's webinar will be delivered to your inbox in the next few days for you to share with friends and family. Thank you, Kensington, for supporting these powerful educational events for our aging community. I was first introduced to Kensington in 2015. Our family made the difficult decision to move my father to Kensington in Northern California. He was living with Alzheimer's, and it was greatly impacting my mother's health, and I did not want to lose both my parents to this dreadful disease. Kensington focuses on relationship-based care, care built on the foundation of their promise to love and care for your family as they do their own. It is programs such as the one you are attending now that are so important to those of us walking through a caregiving journey to hear from expert professionals on keeping us current with the latest advances in care, management, and treatment of conditions that affect seniors and their families. Kensington is truly privileged to support care partners and professionals from coast to coast. Please join me in welcoming Abby and Lynn. I would love it if you could share a few words about yourself and do a little introduction of the program. We're super excited to have you today.
Thank you. We're excited to be here. Thanks for the invitation. Sure, we're happy to talk a little bit about ourselves. Um, my name is Lynn Young. My role at Mansbach Health Tools, home of the BCAT, which is where I'm employed, is Vice President of Operations. I'm a speech language pathologist by background, and I've been out working with adults and older adults who have cognitive impairment for over 30 years. I've worked in all different healthcare settings, hospitals, inpatient rehab facilities, senior living communities like the Kensington, home health, outpatient. It's a real passion of mine. And I've been actively involved in my national association and have presented on the topic of cognition at local levels, also at the state and the national levels. So I'm excited to share some new information with everyone who had the time to join tonight. So thank you for having us.
I
Abby?
think we're lucky to have you. Wow, that's impressive. Go ahead, Abby.
I'm Abby Williams. I'm also a speech language pathologist, and I've been practicing, for close to 20 years. Similar to Lynn's background, I've been in a variety of roles in nursing home settings, assisted living settings, home health. I've done a lot of clinical roles, but I can tell you my time with the BCAT or Mansbach Health Tools has really opened my eyes and has really encouraged my passion for memory and cognition and just overall brain health. And, working with Mansbach Health Tools has just been such a great experience to learn all about this because this is what we specialize in. So we're excited to share more information with you all today.
And I'm going to let you two take it away, but I just want to ask the audience of one thing. And if you can take away anything today, these ladies, Lynn and Abby, are going to share with you tools to be your own advocate at your brain health. And you should share these with your loved ones, your friends, your family, somebody you meet at the grocery store. Because the more you know about cognition, the more you know about your brain health journey, then the more you can help yourself and others that are experiencing it. We're all living longer and we're all going to suffer from a little bit of memory loss or however you guys want to talk about that. But I just think it's really important the audience take this away. This is such valuable information, and we're just really delighted to have Abby and Lynn with us today. And I'll see you guys in a little bit. And I remind the audience, the Q&A function, please submit your questions. We'll get to them. Thank you so much.
Thanks, Susan. So for today's topic, I know we have an abbreviated time window, so we're going to cover a lot of information as quickly as we can. But excuse me, Susan did mention, our view is cognition is a vital sign. And we'll come back to that concept, just like other vital signs like blood pressure and temperature. Cognition can really inform the healthcare team if someone is having a change in status. So it's so important for us to fully understand the cognitive skill set of older adults because it does really give us predictive information about overall function. We're going to talk a little bit about brain health, which may be a new term to some of you. And as Susan mentioned, it's never too late to start taking action and being proactive about your wellness, particularly your brain wellness. We're going to talk a little bit about how the Kensington and others use testing materials, cognitive assessment tools to understand cognition and to quantify it. It's sometimes hard if somebody says, I'm having memory issues. We really need to wrap our heads around what does that mean exactly? Can we test it and see where the deficits are? And also, where are their strengths that we could maybe leverage or use to help support them? We'll talk a little bit about brain health coaching. We do have a National Brain Health Center, and we do offer coaching. So if people are looking for an immediate actionable step for after today's presentation, we'll share resources about that. I'm not sure if we'll have time, but we'll try to get to our case study. So when we say, cognition is a vital sign, it really does kind of hold that place at the center of everything that we do. All of the skills that we need to perform everyday tasks fall under that umbrella term of cognition, right? Thinking skills. And there, you can see there in the table, there are a lot of different skills that fall into that sort of cognitive bucket, that cognitive label. We can't go over all of them today, but we've listed several. We look at things like attention and memory. Can somebody pay attention long enough to complete a task, whether that's cooking or driving, or maybe looking at their checkbook and balancing their numbers? Memory, can someone remember to take their medications or get to an important appointment with their healthcare practitioner? Problem solving, are people able to identify what to do if they're hurt or they're sick? If there's an emergency, can they find places that they need to get to if they're driving in an unfamiliar place? Reasoning and judgment. That's really a key skill when we think about all of the steps we need to take to manage our own health. We need to understand and what is going on. We need to be able to make decisions by weighing pros and cons, risks and benefits, so that we can make choices that will help us maintain our health. Organization. We organize and plan and sequence all day long, right? Whether it's just making a cup of coffee in the morning or doing something really complex like planning a birthday party or organizing transportation to get to an appointment when you're not able to drive yourself. So these are all really important skills that fall into this sort of label of cognition. I mentioned the BCAT, that stands for the Brief Cognitive Assessment Tool. The BCAT is one type of cognitive assessment. We use it to identify issues or deficits in cognition. It's important for any healthcare practitioner who's working with older adults to first have tools in their toolbox to identify, is there a presence of impairment here? And if there is, what's the severity level of that impairment? So the BCAT offers actually 6 different tools in the toolbox to help healthcare practitioners make these initial decisions. Next slide. So what we often recommend is that, we have both screening tools and full assessments, and we recommend that people consider which situation is most necessary or appropriate when they get started. So if we suspect somebody's having very subtle changes, maybe they're reporting, oh, I've lost my glasses several times. I can't find my car keys. It may be okay to just do a really quick screen. A screening tool is usually something that takes 3 or 4 minutes. It's maybe 4 or 5 questions, and it gives us a quick snapshot if there's any cognitive deficits. If somebody performs poorly on a screening tool, we may decide as healthcare professionals that we need more information. So we may administer a comprehensive cognitive assessment. That might take about 10 to 20 minutes, and it dives into all of those cognitive domains that we saw in the slide previous. We're looking at attention, memory, thinking skills, organization skills, safety, mental math, all the tools and skills that we use every day to live independently. And that will give us the information that we need so that we can determine next steps. Our test system even includes information about judgment, which we know is really critical to making good decisions, minimizing your chances of falling, minimizing a medication error, as well as changes in mood. A lot of older adults experience changes in mood and have anxiety and or depressive symptoms, and those symptoms can impact their cognitive level and their cognition. So it's important information to include. Next slide. Actually, our tools are FDA regulated. We are registered and listed with the FDA. So we know that seeking FDA registration was, something that we wanted to do because we wanted to have that gold standard behind our tools and resources. So it is the BCAT is on the FDA registry, and it's used as part of a battery of cognitive tests or tasks to give us that cognitive information that we need. Next slide. When we think about cognition, we think about identifying strengths and weaknesses, but we also want to think about how do we get somebody who maybe has some deficits or who's struggling a bit to a place where they're maximizing what they do have and benefiting as much as possible. Just like physical health, you might go to your doctor and say, I'm having pain in my knee or I'm having pain in my back, and there might be a treatment plan around that. When folks have cognitive changes, we like to put a plan around that as well. We don't want to just kind of wait and see. We want to take action and help that person benefit as much as possible. So just like overall physical health is a lifelong journey, brain health is a lifelong journey. And brain health, the goals of brain health is really to strengthen the brain's defenses, right? Just like lifting a weight will make your arm muscle stronger. We want to build that cognitive skill set as much as we can. We want to protect against any further changes or decline. And we want to promote that cognitive wellness in the lifespan for as long as we can. So that could be for anyone. We have folks that are normally aging who maybe aren't having any changes yet, but who want to keep the good cognition that they have. They can also practice brain health. If somebody has started to show some subtle or mild changes, we want to get in there and offer them some tools and resources. We want to work on memory. We want to help them to stay where they are, whether they're living in a community, living on their own. We want them to be able to age in place in that location where they're currently living. And we want them to be successful so they can still get up and get dressed and do all the things they enjoy. If somebody's cognition is moderately impaired, we still want to offer engagement activities. We know that when persons experience dementia, particularly in the middle or later stages, we start to see some behaviors emerge: agitation, wandering, trying to exit the building or the room, becoming frustrated. The more we can provide cognitive stimulation and activities that they can benefit and enjoy, the less likely we're to see those behaviors. Next slide. So we consider, cognitive assessment a call to action for starting to implement some brain healthy tools and resources. We know that there are a lot of modifiable behaviors out there, from diet to exercise, managing your sleep and your wellness, engaging with others. Those are all things that we have a say in and we can control, and we can help ourselves and take ownership to help promote healthy lifestyle choices. Also, sometimes just knowing if I'm having a change is really the first step. And we offer free self-screening tools that folks can do in the privacy of their own home if they'd like to spot check their memory or see what their lifestyle choices are like. Am I on the path to brain wellness, or are there things I could be changing? We offer a freestanding website called the Enrich website. And there you can find these tools as well as an opportunity to sign up for what we call the Enrich membership. You're going to receive a free brain exercise of the week every Monday. and then other informational emails about brain health, resources, tools you can use on your own journey. And if that information comes back and tells you that maybe you are having some changes, as I mentioned earlier, we do have a National Brain Health Center where a certified brain health coach can connect with folks and help them create a plan, create some lifestyle changes, offer some cognitive exercises and activities, and pull together a nice program for them to help improve their brain health. Next slide. We listed here some of those brain health modifiable lifestyle factors, things that we often look at or discuss with our clients because we know that having a healthy diet and, mitigating that depression and anxiety, having social connections with others, and all the things you see here work together to help promote brain health. We've all been sleep deprived, right? Whether it's when you had a small child or if you were sick or if you were traveling in a different time zone, and it starts to create sort of that fogginess, right? So we know, for example, sleep is an important component to maintaining our cognitive wellness. So we can talk about and cover some of these key lifestyle choices to help people maximize their wellness. And I'm going to hand it over here to Abby and let her take you through some of the tools and resources that I mentioned so you can see exactly what I'm talking about. Abby, it's all yours.
Thank you. Yeah, so this was all, thank you, Lynn, for sharing all this great information. And now we're just going to go through what the resources look like, what the tools look like. So I'm going to exit out of here. You will be receiving this brain health resources. Many of them are free, some of them are paid. And I'm going to go through all of this right now. So all of these can help promote a brain healthy lifestyle. So I'm going to go through these self-screening tools. I'm going to show you where the free brain exercise of the week is. I'm going to talk a little bit about our Family Matters interview series, and then lots of other books and programming and resources. Okay, so first is a review of the Enrich Visits website. This is kind of a sister website of the BCAT. We call the BCAT with the test systems, as Lynn mentioned. That's how do we identify the cognitive level. The Enrich site is more of our brain health resources. So the first thing that you're going to see when you go to the Enrich Visits website, you're going to see this button to subscribe. This is totally free. What this means is if you click, you would just enter in your first name and your last name and then your email address. And then this is how you receive your free brain exercise of the week, which is delivered straight to your email box every Monday morning, as well as just some other general brain healthy tips. So Lynn mentioned the BH7 or the Brain Health 7, those 7 components that it's important to look at and manage to help lead a brain healthy lifestyle. So you would get tips about sleep, about managing your mood, about diet, about exercise. And they're just brief, short tips. So this is how you sign up for the brain exercise of the week and some Enrich lifestyle tips. The next one I want to show you is the Enrich calculator. So this, there are 3 self screens, and these can just help you to identify things that you could potentially need to work on. You could take the results to your physician or to another healthcare professional that you're seeing for more guidance on what to do, or there is an action plan. So I'm going to go through the Enrich calculator quickly so you can see how quick and easy it is. You're just going to click Get Started. So during a typical week, and how many days do you physically exercise for at least 30 minutes? You can select one. Are you smoking? Yes or no? How much do you do cognitive exercises? So it gives some examples. Whether or not you're feeling depressed or any kind of level of anxiety. If you know what your blood pressure is, I'm just entering in numbers. Oops. Okay, there's just a quick indication of your BMI. Now, you can enter in your email address, but you don't have to. If you just want to see results, no thank you. Show me my score. Okay, so this is my score. It's a relatively low risk based on those key lifestyle habits, which places me at a relatively low risk for dementia. Now, there's a lot of other factors for dementia, but just based on these key indicators. So it's going to show me some ways to improve my score. So step one, I could do more physical exercise. Step two, these are some exercises I could try. I'm not going to smoke. I'm already not smoking, and I'm not going to continue to smoke. I can do some cognitive exercises. So it just gives you some steps, some actionable takeaways. There are two other self screens. The first is my mem check. This is going to test your memory. So if you feel like you're feeling forgetful, or say your mom or cousin is forgetful, send them this free self screen. It's not a diagnosis, and it's not going to provide you with, you have dementia. It's not going to tell you that, but it might say, hey, you need to get this checked out. So similar to the Enrich calculator, you're just going to click Start My Mem Check Now. You don't have to click your email, or you can enter in your email, and then you're just going to go through. It takes just a few minutes to do. Then there's mood. Mood is a very important aspect of leading a brain healthy lifestyle. So this is your 1-minute stress test. Similar to the Enrich calculator in the My Mem Check, it's just a very quick self-screening tool that's just going to give you an idea of how your mood feels. So if you do a combination of those 3 screens, you're going to get a good idea of any kind of lifestyle changes that you're going to need, or if you need to reach out or pursue a healthcare professional, or what you need to change in your daily life. So those are the 3 self-screening tools. I'm going to show you a little bit about the bookstore. There are a bunch of books listed. We have a lot of books focused on brain health. The first, these are Mempix books. Those are not listed. Those are for those with a later stage of dementia. These are books for really improving memory and cognition. So the first is the BCAT Working Memory Exercise book. This workbook really provides you with tips, strategies. It really works your working memory exercises. It's an actual paper and pencil workbook that you could do. Paired with the Brain Sharp, this Brain Sharp exercise book has 3 common activities: mazes, word searches, and word scrambles that are easy to hard. So when you combine these 2 books, it's this package, which is the Brain Health Workout Kit. This is a really great package to consider because there are some familiar exercises that are more fun to do. And then there's these really structured exercises which really improve your working memory. Dr. Mansbach also created or wrote this book, Brain Health as You Age. If you want to learn more about brain healthy lifestyle tips, this is a great book. This goes through all of those brain healthy lifestyle tips. It backs it up by research. It's a very robust book with a lot of information about brain health. This is our newest book. It's called the BCAT Brain Fitness book. This book is at a digital download. So say you don't want to deal with the mess of, paper and pencil. This book, if you purchase it, it is emailed directly to you, and you can just print out sheets that you would want to work on. You can also just do it on your laptop. You're not going to be able to enter in the information, but you can look at the laptop and you can participate in the exercises. There are hundreds of exercises in this book that are cognitively stimulating and challenging, even for those with normal cognition. So we made it to where there's 3 levels, and level 3 is for those with normal cognition, and they are very challenging. So those are fun to do as well. I quickly want to show you around the 15 for Me app, which you're going to see. The 15 for Me app was designed to help in stress reduction. So it combines the 3 C's of cognitive, cardio, and centered breathing exercises. This is what a dashboard would look like, but there are a variety of cognitive exercises. There are cardio exercises offered. They are not videos. Rather, they are kind of PDFs to follow of various exercises like strength training, circuit training. And then there are a very large variety of centered breathing activities. The idea is to do the mood 5, so that 1-minute stress test, take your stress temperature, participate in 10 to 12 minutes of either cognitive exercises or cardio exercises, and follow that up with 3 to 5 minutes of centered breathing. And then if you retake your stress temperature, you should see a reduction in your overall stress. So this is a great program if you're looking for improving your brain health while reducing your stress. This is kind of what the 15 for Me program looks like. So it's a web-based app, and it is on that resources page in case you're interested in learning more. Counterpoint is the BCAT sister company. It's also owned by Mansbach Health Tools, and this is our behavioral health company and services. This is where you're going to find the information about the National Brain Health Center. So there's a lot of information about what does the NBHC or the National Brain Health Center, what does it offer? What are the program goals and who is on the team, and some testimonials about people that have gone through the program. We've got a lot of great testimonials. You can also click here to learn more about our coaching services. So that is a very quick rundown of all of our services within the Enrich website, within the 15 for Me, our books, and then the National Brain Health Center. So I know we wanted to save time. We have a lot of questions. So I think we are about ready if we would like to do any of those questions.
I would like to start by saying bravo. I'm so excited for our audience, and I'm so excited for our audience to share this with others because you hit on a couple things that is so important. And I'm glad that both of you said a couple times what's good for your heart is good for your head. And that is so true because we live in one body, we have one mind, we have one physical body. And I'm so glad that you guys really talked about that because our audience should understand this is more than just brain health. This is really mental and physical health as we age, and we're aging longer. And the other thing I thought was so important, well, I thought so many things were important, but I'm just going to touch on a couple, is you really talked about modifiable behaviors. And to the audience, there are certain things you can do for brain health and heart health, and there's certain things you kind of can't do. And they can't really change your genes, thank goodness, not yet. But there's certain modifiable behaviors that you talked about, the sleep, the social engagement, the cognitive exercises, the diet, the physical exercise. I'm just so
Right.
impressed that you really are looking at the whole body, not just focused on the brain.
Real quick, I
Absolutely.
mentioned some of those testimonials, and that's exactly what some of our clients have said that have gone through the brain health coaching. They said it's not just about doing the memory exercises, it's about changing your lifestyle behavior by doing more exercise, which then could lead to better sleep. It's changing your diet, it's eliminating, certain fatty foods or sugars, or maybe reducing caffeine later in the day, which also affects your sleep. So it's like everything kind of goes together. And then the more you're exercising and the better sleep you get and the better food you're eating, your mood improves. So it kind of all just goes together.
Yeah, and it's important to remember if you can manage, a healthy weight, you can reduce your risk for diseases like dementia. And similarly, Susan, you even just mentioned cardiovascular disease and diabetes. Again, if we can reduce our risk for those diseases, we can simultaneously reduce our risk for dementia. So there is a lot of interconnection in your physical health and your brain health. It's really quite interesting to think about how everything is connected.
And you know what? Information or knowing who you are and what you have is powerful because you can be your own advocate. You can depend on certain people for certain things, but at the end of the day, you have to be your own health advocate. And I just loved that all this information we can get. I mean, I have your books actually, and I do use your books. And but the more information you know is so valuable, and the key indicators, you know, so many people say, oh, I don't need to go to a neurologist. Oh, I'm actually okay. But the more information you have by taking these tests and take that to a doctor, you're ahead of the ball. You already know who you are. And so I think it's so powerful. I'm super excited about all this. Um, and one question I have for both of you is all the books and everything, especially the brain health exercise book. What are the thoughts about, I'm worried about my husband. Maybe we could do that together. Do you ever suggest like family or friends that you do that together if someone's reluctant in engaging? Because, Some people are like, I don't want to know. I don't want to know. But I will hopefully convince everybody today that you actually do want to know. What do you think about that?
I'll go first, then I'll let Abby jump in as well.
Yeah.
I think that's a great point, and it's interesting. Our brain health coaching clients bring their families to their coaching sessions, and we talked with a husband and wife who did it together. The husband had to cut out sugar, so she cut out sugar. He had to walk more, so she walked with him. They did the cognitive exercises together. She really wanted to improve herself, and she wasn't having nearly as many cognitive changes as he was, but she was being proactive and getting a head start on her brain health and working just as hard as he was on her overall wellness, the sleep issues, the diet changes. So it definitely can be something people can do together. I'll let Abby comment as well.
I wanted to say that there are, when we deal with folks who have a memory impairment, whether it's a dementia or something else, it's very evident that most of the time they're resistant, right? So they don't want to accept that they have a memory problem, or they'll say, oh, everyone forgets every now and then, but I can remember, when I was a kid. So when you bring in the spouse, that means I'm going to do it, even if the spouse is in on it, that means you're going to direct those activities to both of them. You're going to say, this is good for both of you, rather than, even if they're of sound cognition, these are good for everyone. As I mentioned, a lot of our exercises are good for those with a normal cognition. So it really is good for everyone. But at the same time, including the spouse is a really good strategy, especially if they're resistant and, kind of fighting and not really willing to accept that they have memory problems.
And a lot of those resources have beginner, intermediate, and advanced versions of each exercise. So if you want to challenge yourself with the more advanced version, while your friend, neighbor, sister, whoever is doing the moderate or beginner level, you can do that.
I just think it's so important because exercising your brain, as you said, cognition's a vital sign. It has been proven, and I'll say this over and over again, that if you can exercise your brain by learning new things, by doing these exercises, it actually improves cognition. So I see it's a slam dunk for me. Um, I have a
And I
question
just want to say, and also it's use it or lose it, right?
for you.
So,
Well, yes. And you also talked about being social is so important. And I'm doing a webinar on solo aging because that's a concern. We're getting older and some people are aging alone, and being social is so important. That's why I was asking, do it with friends. Have a little brain health exercise, book club. Get together and do
mhm.
your brain health exercises. I mean, it's really fun. I think the books are fantastic.
You can even do it virtually, through Skype or FaceTime, or, if you have family that lives far away and you want to do it together, you could each purchase a book and work on it remotely. I mean, we even have older adults and grandkids doing things together, through virtual connections. So, especially during COVID, a lot of people were connecting virtually. So it can be done.
It can be done, and it's so cool to know your score. That's just so
Mhm.
important because you don't just say, "Oh, this is your score." You give, suggestions like maybe you want to do 5,000 steps a day. You've been doing two, or So I just think it's ideal. I have a question here about how do cognitive tests differ between children and adults?
So I will give a disclaimer that our tools and resources are typically not used by pediatrics, but I think in general, we're looking at two different sort of populations. Children's cognitive skills are emerging, where adults already have sort of fully evolved cognitive skills, and we're often looking at changes or decline. So it's a little bit different. I think some of the differences between the testing materials for children is obviously the vocabulary is different. The questions are shorter. We know there may be a different attention span capacity there. People may offer more frequent breaks for a pediatric client versus an adult who may be able to attend for longer periods of time. Um, oftentimes, there's more pictures, there's more visuals, there's more game type questions or subtest items. Whereas the adult focus, we're looking at the cognitive sub skills to live independently. We're looking at someone's ability to remember facts, to be able to manage time, to be able to attend and focus and retain specific information that they might need, sequencing, planning, organizing, because those are the sub skills of life. Those are the sub skills of making your own meal or remembering how to navigate to your pharmacy to pick up your medications. So there's definitely a little bit of a difference between those two different types of assessments. And I think the last thing I'll say is, some pediatric tests are developed for specific age groups. You might have the preschool group or the school age child or the pre-adolescent or the adolescent. And adult-based cognitive assessment is really looking at sort of the baseline of what do you need to do to function in the world. So anybody who's, 21 and up or 50 and up may have some of the same skill requirements if you're going to be able to live alone, manage your day to day.
And I believe Abby is answering your question, Donna, but I'm going to ask this to the audience. And the reason I'm going to ask it to the audience is I think we all think about this because our cell phones are connected to us, and it's just a reality of life. It's a little mini computer that we never thought would be so incredibly powerful. I mean, my mother, who's 89, calls her cell phone her best friend, which is, I think, pathetic, but it's a little bit of a reality. But Donna asked a question about her husband, who always is on the phone, scrolling, 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 scrolling. And she believes his attention has suffered from that. What are your thoughts?
Well, I have a few thoughts on this. It could be what came first, a situation of what came first, the chicken or the egg. So a lot of times, if your husband is starting to have some memory problems or just some decline in cognition, it's easy to just go on the phone and just mindlessly scroll and swipe. And, that's an easy thing. It's not challenging him. It's not requiring him to do anything extra. It's relaxing for him. Now, it's a use it or lose it situation, as I mentioned before. So if if he's engaging on his phone, that means that he's not doing something positive for his brain. It's more negative. It's taking away or subtractive. So it's probably a little of both. So what do I recommend for it? I would say if it's his comfort to be on his phone, if he likes to be on his phone, download some apps. That you could get. There are some, that 15 for Me program. It's a web-based app, and you could put the app right on the phone, and he could do some cognitive exercises on his phone. Or you could download some other apps that have cognition. You could download like Sudoku or word searches or something like that. So he's doing something positive on his phone versus subtractive of just doom scrolling. So hopefully that would help. Additionally, find another activity that he might enjoy. And maybe just have a conversation. Okay, we're going to do this together. Let's put our phones away, and let's do this together. So it could be doing a puzzle. It could be doing a game, taking a walk, FaceTiming family, anything to just get away from that. So you might have to do some creative thinking based on his interests.
I do think sometimes, to Abby's point, the chicken or the egg, if you're having a hard time reading a novel and remembering what you read yesterday, who the characters are, what's the plot, people tend to abandon things that they previously enjoyed because they're becoming too hard, or watching a 2-hour movie, maybe too challenging. I feel like they automatically find ways to pivot to something easier, shorter, less complex. But to Abby's point, we do want to keep challenging that engagement so that we can get back to where we were or as close as possible while also engaging in those positive lifestyle choices.
I'm giggling here because the question that Donna asked, I'm thinking about driving by, a school bus stop. Kids aren't talking. They're not engaging. Everyone is on their phone. You go to the grocery market now and you walk through there, and not only are they looking at their phone, but they're talking on their phone. So I think it's an adaptive lifestyle, but I simply say, please get off your phone. But I like the redirecting. What can we do together? Which is actually another question that I think I could answer, but I'm going to let you guys answer. What about bridge and dancing as cognitive exercise?
So, with cognitive exercises, when we say participate in cognitive exercises, we mean exercises that are more research-based, science-based, evidence-based to show that are shown to actually improve cognition. There are a lot of brain games out there that are still good to do, like doing crossword puzzles or Wordle every day, or doing Sudoku, as I mentioned before, but they're not evidence-based to improve cognition. Bridge is a great game, especially if you're learning how to play bridge. But is it evidence-based and science-based? It's not, but that's okay. It doesn't mean don't do it. It just means that you could still do something else to actually improve your cognition. If bridge is something that you enjoy doing, by all means, that's a very positive activity. It requires, number one, social engagement with others. Number two, it's going to require your attention and concentration, a lot of cognitive domains, memory, attention, executive function, just to play the game. Dancing is a cardio activity. So that's absolutely great for your brain health. It's not going to be positive for cognition per se, but it's excellent for brain health. Staying active and dancing is a great way to get in your physical exercise. Hopefully that helps.
Yeah, we
That,
always recommend at least 15 minutes a day of moderate activity. So, anything's going to kind of
Yeah.
get that heart rate up a little bit. Dancing would be a great way to do that. That doesn't feel like, let's walk this track 10 times in a circle. Like that just feels more fun than, maybe doing some other activities. So anything that gets your heart rate up and boosts your heart rate is a benefit to the cardiovascular system. It's a benefit to the brain. So I love that.
and music is a benefit to the brain.
Yeah.
100%, because you can sing all those good songs, and then it's a fun activity as well. So how does one ensure the reliability or the validity of these tests?
It depends
Oh,
what you're looking for.
yeah.
Oh, go ahead, Abby, I didn't mean to cut you off.
No, go ahead.
I think, if we're thinking about um, what to pull, like if you're out shopping around for assessments, you want to make sure that there's research behind the tools and resources that you use. And you want to really be sure if you're looking for an assessment tool that you're not picking up a screening tool. So if you remember at the beginning, we talked a little bit about the difference between a screening tool and an assessment. A screening tool is designed to identify the presence or absence of impairment. They're short, they're quick. An assessment is a deeper dive. It's looking at all these key areas and identifying which specific areas are impaired so that we can, moving forward, create a plan around how to support and address those areas. Standardized assessments are really the gold standard. We all work with older adults, and a lot of older adults have Medicare. And the Centers for Medicare Services, which is one of the regulatory bodies that looks at the standardization of assessments and supports that process, they're looking for tools and resources that have been put through research protocols that have been developed with, evidence in mind that shows that the test is actually testing what it says it's testing, right? We want to make sure that if you have some type of change or disorder, that the test is picking that up. And if you don't have it, that the test is telling you that you don't have it. So you want to make sure that the tools and resources you're using have been put through some type of research protocol, maybe even been published. That will ensure that the tools you're using are appropriate and at that high gold standard quality.
Abby, do you want to add anything?
I mean, it's hard to find exercises that are proven to improve cognition. A lot of companies will claim that, so it's hard to kind of read between the lines. The BCAT stuff is all evidence-based, but at the end of the day, if you're participating in something that's challenging, moderately challenging, and still fun, then that's a good sign.
And I have a question that came in at the beginning, but I'm going to re-ask it. And the different types of cognitive tests. Someone asked about the MOCA and some other tests. Would there be any reason that I would take one and then I'd do another, or do you kind of stay the lane and stick with one? What are your thoughts on that?
The MOCA is a screening tool, so that's used quite a bit in like acute care hospitals, emergency rooms, where they just want to know if somebody's having a cognitive change. The BCAT is used primarily, it's used in those settings as well, but it's also used in senior living communities, nursing homes, home health by rehab professionals, inpatient rehab facilities. Because it's an assessment, it gives predictive information about what does this person's memory look like? What does their attention look like? What about their thinking skills, those sequencing, planning, organizing skills? It gives a roadmap of how to treat it. So it depends what the practitioner is really looking for. If they're just looking for some quick information, we have our own screening tool. It's called the BCAT short form. So if someone has obvious decline or change, that immediately will trigger a full assessment. So, we have our own research center, which is why our tools are used by so many practitioners out there. And because they're reliable and they're valid and they give that treatment planning information. Assessment is great, but what do you do once you find out you have these deficits? You don't want to just walk away with, okay, I have issues. Now what do I do? You need a plan of some kind. How will we address that? How will we remediate what we can remediate? How will we leverage your strengths? Educating folks about their current status is important. So once you've done any kind of treatment or intervention, you can compare where you were before and where you are after to see if you're making gains and improvements. So using a standardized test like the BCAT is a gold standard for comprehensive assessment.
I think that's really important because we can all get information, but you're giving someone a plan, not just, oh, here's the information and what am I going to do with it? But you actually have a plan, a contingency plan of how to go and also how to measure your cognition over time. I just think what you guys are offering is fantastic. But
We
I,
know that cognitive skills are predictive of functional skills, right? So if someone has memory impairment, attention impairment, and organization deficits, they could be struggling with setting up their medication routine every week because they have to read the label, they have to pay attention to the dosage, they have to be able to put it in their pill box, they have to go back and forth between several different pills and pill bottles in the box. They have to pay attention to the labels on the box and not get Monday morning and Monday afternoon mixed up. So it's predictive of functional changes. And we want to get to that so that we can lower risk for folks so that they're not making med errors, they're not having, missed doses, and they're not impacting their overall health. So it's sort of like breadcrumbs, right? We want the assessment because we want to know what the skills are. The skills predict the functional performance, and the functional performance can be a differentiator of where somebody is able to live, what their level of care is. If someone's living at home alone and they can't manage their meds and they can't prepare their meals and they're unsafe and they make bad decisions and they've wandered away or left their doors unlocked or burnt a couple pots on the stove, then they may need to move to a more supportive environment. So cognition can be a vital sign, a red flag if someone's having changes that we need to put some supports around that person.
wow, well said, really well said. Abby, do you want to add anything?
Just to add that, you know, I think the question was what's used more, the MOCA or the BCAT? And that's hard to say. I can't speak to what is being used with the MOCA. But like what Lynn said, the MOCA is the cognitive screening tool, and that's it. It has a very limited function. It's just one cognitive screening tool, whereas the BCAT is a whole test system. So it's a lot of times our tests are used together. We have practical judgment tests that are used with the full BCAT or with the short form, our cognitive screening tool. We have a mood assessment. We have a severe assessment. So for those that are with a known dementia, we have an assessment for them. So there's a lot more there And we're able to, like those healthcare professionals that use the BCAT are able to provide a full, complete assessment using the BCAT.
I don't know why anyone wouldn't start with your screening and then go on and subscribe. I mean, I mean, the information is so powerful. Um, I just want to remind everybody that you'll be receiving a copy of this webinar. Please share it with friends and family. And the takeaway here is try the screening tool, because the more information you have, I think is so important. Another question came in. Is it possible to view this webinar again? Yes, you'll receive a copy of it to share, and you will also receive all of the little links that Abby took you through. So it's going to be so easy. I just saw it. She put together this great little resource for you. You should save it in your file because it gives you the links to be able to take all these tests, which is great. I want to end with one thing. Unfortunately, we're out of time. It seems to always go by so fast, but I want to thank Lynn and Abby. But I want to end with one thing that I thought was so important today. So it's my other takeaway for the audience, and that is you talked about breathing. And I actually just listened to this very powerful webinar about reducing stress. And the gentleman came on and he said every morning he does what he calls box breathing. And it resets your day, it resets your whole nervous system, actually. And I think we should end with that. And I know I've had the flu. I know Lynn's had the flu, so we'll probably start coughing. But I want the audience to try this. Just try it. And you're going to breathe for 10 seconds through your nose. So go. Fill up your diaphragm. And then you're going to hold it for 10 seconds. And then through your mouth, you're going to exhale for 10. And this doctor said he does that every morning before he gets out of bed. He does it 3 times. So it takes what? A minute. And it's so powerful for just setting your day. I just can't thank you guys enough. You just hit on so many different points. I can't wait to watch this again and send it to my friends and family. So thank you. And everyone have a good night if you're on the East Coast. Have a good afternoon if you're on the West, but be safe and be healthy and don't get this flu. It's pretty wicked. Thank you so much. Have a great day.
Thanks for your time.
Thank you.
Thank you.